Scientists have new concerns about the deadly bird flu virus after a second strain was detected in 6 cow herds this week. It is the first time this variant was found in dairy cattle, meaning it made the jump from one species to another. And now scientists are worried that the infection could soon spread to humans and make it more difficult to contain. Jessica Malati Rivera is an infectious disease epidemiologist and a senior advisor at the Pandemic Prevention Institute. Great to see you. So this new report just in from the USDA found that the newer strain of bird flu has a genetic change that may help the virus infect mammals more easily. How concerned are you about this?
You know, Frederick, it's really concerning because we've not seen an outbreak like this. It's quite unprecedented to have this many animals, particularly mammals that live in close proximity to humans, have this many cases. And with every new infection, the risk of mutation increases. And so when we saw news that this new, more severe genotype that had previously only been infecting birds, now in dairy cattle, it does raise a lot of alarms that we are not ahead of this outbreak. It is happening at a scale that we cannot get a hold of. And in the absence of really good data and really real-time data, we're kind of flying in the dark here.
So what has to be done to get ahead of it or at least contain this outbreak?
A few things. We need massive surveillance. We need to upscale our surveillance at a very local level with farmers, with cattle, with all types of bird species. We need to increase vaccination access to those who are most at risk. Those include farmers and people who are in close proximity, like veterinarians. And we need to have really good data systems so that these are really transparent, so that people can see exactly what's going on. These delays in the information are making it really difficult for folks to have responsive public health measures. And we've not really seen a delay like this since what happened with COVID-19 in those early days of the pandemic.
So you said vaccination. Wait a minute. There's vaccination against bird flu for mammals?
There are vaccinations available for mammals. And right now, even with humans, for instance, seasonal flu vaccine will actually really help, because one of the concerns that we have is something called reassortment. And reassortment happens when somebody with a regular, say, human flu type is infected with that and then gets exposed to, say, H5N1. Those two flu viruses can reassort and then essentially, like, think about a deck of cards reshuffling, and can then adapt in a way that will make it turn into a different type of virus that can then affect the upper respiratory tract, which right now it's more of a lower respiratory tract infection. But seasonal flu vaccines are actually one way we can keep this down, because we don't want people having a combination of seasonal flu plus bird flu. But for bird flu vaccines, it is available to mammals, and they are vaccinating animals right now, but they're just not doing it at a scale that we would hope to see.
So what do you want to see happen next?
Like I said, we need better surveillance. We need better data systems and reporting. I mean, just this week, we saw the CDC's MMWR, which is the Morbidity Mortality Weekly Report, finally resume after a 2-week kind of unprecedented hiatus. What we were expecting to see were the 3 reports about H5N1 that were in the pipeline, but instead we saw a report about the wildfires in Maui and in Los Angeles. And that's the kind of data that will really help us make better informed choices. And so the biggest thing I want to see right now is transparency, communications, data, reporting, better surveillance. All of these things are really lacking right now, and it's causing us to have a really slow response to this unprecedented outbreak.
Well, if you believe all those things are lacking now, what are your concerns or thoughts, or what do you look forward to if there is a vote of confirmation this coming week? Robert F. Kennedy Jr. Is nominated as Secretary of Health and Human Services. What are your potential thoughts, concerns about what's on the horizon?
You know, the danger of having somebody like RFK Jr. at the head of HHS, an industry, an agency that oversees a workforce of over 80,000 people and a $1.7 trillion budget. The danger of this cannot be understated. We're talking about somebody who has a basic misunderstanding of the very thing he's trying to solve, chronic diseases. To not understand that infectious diseases are a large driver of chronic disease infections is a huge misunderstanding. And to want to cut infectious disease research for what he said 8 years during an unprecedented infectious disease outbreak is unbelievably dangerous. What he's trying to do is relitigate evidence or science for which we have mountains and decades of evidence to prove the very thing that he's claiming either doesn't exist or is not true. It's unusual that he also continues to invoke the scope of work that is outside of HHS, things that would be under the purview of, say, EPA or even USDA. And so we need somebody who understands the science of chronic diseases and infectious diseases, who understands the principles of public health, which is harm reduction, the value of some of the greatest gifts that public health has given us, which is vaccination. And to have somebody who kind of refutes all that and is antagonistic about all those things is deeply concerning.
You're an epidemiologist, but you're also a mother of three. What's your confidence level about whether your kids will have the access to all the vaccines that you believe in?
Oh, that's a terrifying question, to be honest. I don't think that one person can single-handedly just ban vaccines. I think that that would be absolutely incredibly difficult to do. But what we are talking about here is, what he's proposing is almost creating these parallel systems to retest or relitigate the value add, the safety and efficacy of vaccines, for which we have, again, like I said, tons of data. I don't think vaccines will disappear immediately after a confirmation of RFK, but I do think it's going to be very difficult to possibly, especially in some jurisdictions that are more antagonistic to vaccines, where they become more, optional. It may be harder for some folks to either get access to them or to get good information about them. Right now, we're even seeing the basic papers that come with a vaccine appointment no longer available on the CDC's website. You have to go to places like immunize.org to get that information. So it's not a good precedent that we're setting right now on vaccine confidence and vaccine availability, but I'm hopeful that one person cannot just delete the access to them.
All right. Jessica Malati Rivera, thank you so much. Good to see you.
Thanks for having me.